Hey everyone, welcome back to this new series. In this series, we are going to discuss about pharmacology. So, our first class will be on respiratory drugs. So, what's the motto of this class is we'll discuss about the drugs, we'll discuss about the classification, we'll discuss how they'll work in our body and why we need to learn about those drugs. So, this is the main theme of this class. I hope this class will be somewhat engaging and you'll learn something new in this video. So, we'll start our first class on respiratory drugs. By the way, my name is Tony Stark, and in this channel, we are going to discuss a lot of stuff regarding your semester exams. And please follow, subscribe, and make sure that you'll on that bell icon to reach that notification to your phone when I upload the video. Thank you so much. So let's begin this video. So first we'll start with the introduction. Respiratory drugs are medications used to treat conditions affecting the respiratory system. Understanding these drugs is crucial for safe and effective nursing care. This presentation covers key drug types, their mechanisms, and nursing role. So, what we need to know about respiratory drugs? These are the medications. They treat the conditions which affect the lungs. Not only lungs, it will take care of entire respiratory system. We know that respiratory system starts from mouth and ends with bronchi and alveoli in the in the lungs. So these are the medications that will treat any disease condition or any disorder occurring to that system. That's the main definition of respiratory drugs. Now we'll ask ourselves a question. Have you or anyone at home ever had asthma or used any inhaler or Vicks or cough for like cough syrup? Everybody does, right? Like right now I'm feeling I'm having a cold. I used last night I take cetirizine. That's a drug for respiratory system. Likewise, everybody in your entire life used any of these drugs. So what the question is, why we need to take those drugs? Why can't we take a paracetamol or any antibiotic? Or why can't you take any home remedy? Why we need to take exactly related to those drugs? That's the question you need to ask to yourself so that you'll understand the topic very well. So when we can't breathe properly, like asthma, cold, or allergy, doctors prescribe drugs that help open up the airway, remove mucus, stop coughing, or relieve blocked nose. All these medicines are called drugs acting on respiratory system. Okay, this is the why we need to use those drugs, those preferred drugs prescribed by the doctor for removing mucus, and it will allow us to stop coughing and it will relieve the nose. So these are the symptoms for respiratory disorders. First, we'll start the overview drugs, overview, what are the drugs, classifications, and everything. Again, we here there is a definition. There is a proper definition. Let me read it for you. Yeah, respiratory drugs help manage diseases like asthma, COPD, and allergies by targeting airway function. Nurses must understand drugs action to monitor efforts and educate patients on on proper use and side effect management, ensuring optimal patient outcomes. Okay, this is pure generated by something. This definition is not good. Which I said you before is really good. The drugs which acts on the disorders of respiratory system are called respiratory drugs. That's a simple definition. Okay. Now we'll see the starting from the basics. We'll learn something what we need to know about respiratory system. In anatomy, when we come to anatomy, we know that we have airway. Airway consists of mouth. It will start with the nose. Okay. and ends with bronchus, bronchioles, and alveoli. This is the ending system. Okay. Now we'll start with lungs, alveoli, where gases exchange takes place in alveoli. From where? From alveoli to blood system, like bloodstream. Okay. This is the main anatomy of respiration. Water, air enters through the mouth. Air enters through the nose or mouth, reaches the airway canal, and it will reach the bronchus. It will reach the bronchioles and bronchus, and there it will divide into small canals called alveoli. Where in alveoli, the end of the alveoli, see, if this is the end of the alveoli, it is connected to blood vessel. So from here to inside the oxygen, like to inside the blood vessel, the oxygen will flow. From here to inside, oxygen will flow, and from inside to outside, like carbon dioxide will come out. Okay, this is the main anatomy and physiology of respiration. Now we'll discuss the classification of drugs in respiratory system. How drugs are classified? There are mainly these are the main types of classifications. First, we'll discuss about bronchodilators. Next, we'll discuss about decongestants. After that, we'll discuss about exporants, antitussives, mucolytics, bronchodilators, bronchoconstrictors, and we are having bronchodilators and we are having bronchoconstrictors and antihistamines. These are the classifications. So each classification, how many classifications are there? One, two, three, four, five, six, seven. We have seven classifications. So seven classification will be divided into subclasses like bronchodilators. There are three classes, and antihistamines there are or two types. Like they will be divided. So you need to be concentrated and you need to take the note while I'm explaining what are the classes and how many subgroups it is divided and what are the examples. Okay. First, we'll discuss about drugs acting on respiratory system. Now that we know, no, sorry, we'll discuss about bronchodilators. Okay, sorry, bronchodilators. What are bronchodilators? First classification is bronchodilators. It is also called as anti-asthmatics. And now we'll discuss about how it will work in our body. For what we need to use that in your body. Okay. First, we'll read the concept. Explain the disease. Asthma or COPD airway becomes narrow. Becomes because of muscle spasm. What is muscle spasm? Spasm means muscle will be constricted. Okay. Because of COPD and asthma, what happens in our body was the airway, which I showed you earlier, the airway will be constricted. There will be no enough place for air to go from nose to the lungs. So there will be because of a mucus or because of any infection, this might cause. Okay, the cause may vary, but the end result will be the constriction of the airway. What will happen? What will help a person breathe easier? A drug that can relax airway muscles. That's a bronchodilator. So this is a concept. We'll see the types. You understood right? Bronchodilators are the drugs used for dilating or expanding or relaxing the airway are called bronchodilators in a simple way. Now we'll discuss about the types. There are three major types. First is beta 2 androgenic agnostics, and second one is anticholinergics and methyl xanthines. These are the three types. Now we'll discuss about the first type, beta 2 androgenic agnostics prototype. First, like example, salbutamol. You all know about salbutamol, right? I hope you all know that salbutamol. Now we'll discuss about this is a salbutamol is a drug. It's an example. Okay. Now we'll discuss the composition of This drug, first active ingredient is solvable. Chemical class is selectively beta 2 androgenic receptors or what is the action of this type of drugs? We'll discuss about the action. Acts on beta 2 receptors in bronchial smooth muscles, activates androgen glycase, which increases glycic AMP, and where CAM relaxes bronchial smooth muscles, bronchodilators. What is this? Like, what do you understand in this? What are beta 2 receptors? What are adenylyl glycase? What are these? We don't even understand what is this. So now we'll discuss how we take a tablet or like any type of beta 2 androgenic agnostic drugs. Any type. Okay, here for example, salmetamol. How we need to know the mechanism. Mechanism is very important for every drug. So here what they said was this drug will act on beta 2 receptors in bronchial smooth muscles. It will act this drug will act on beta 2 receptors which was there in the smooth muscle, which activates adenylyl glycase. Now what the fuck is adenylyl glycase? I don't know what is adenylyl glycase. Nobody knows what is adenylyl glycase. So we'll discuss what is adenylyl glycase. So beta 2 receptors, androgenic receptors present in bronchial smooth muscles. So what are beta 2 receptors? Those are the receptors present in smooth muscle in bronchus. Okay. The beta 2 receptor stimulates and activates an enzyme called adenylyl glycase. So when this drug, let me explain you further. When we take salbutamol, we'll take as a S. This will act on beta 2 receptors. Beta 2 receptors which are present in smooth muscles in bronchus. Okay, that you know. After acting on beta 2 receptors, what they will release? They will release an enzyme called adenylyl glycase. This is the enzyme released after the drug acts on beta 2 receptors. I hope you got the point. This is the enzyme released after the drugs acts on a beta 2 receptors. First, the drug will act on a smooth muscle receptors called beta 2 receptors. After that, the beta 2 receptors release an enzyme called adenylyl glycase. Now, what does this enzyme do? This enzyme converts ATP, which we don't know what is ATP. We might forget what is ATP. ATP is adenosine triphosphate. It will convert this ATP. This is an energy molecule. Everybody know, right? To glycase AMP. What is glycic AMP? Glycic AMP is a adenosine monophosphate. What happens here was this enzyme converts ATP into AMP. Okay. What is ATP? ATP is a adenosine triphosphate. We have three phosphorus like we have three phosphorus molecules, right? ATP having three phosphorus molecules. Now what this enzyme will do? It will remove two phosphorus molecules from ATP and converts into AMP. Sorry, I don't have a pen to write on the screen. That's why I'm writing with AMP. So AMP is a monophosphate, which means it lost two phosphorus molecules and it was converted into AMP. Okay, this is fine. This enzyme converted ATP into AMP. Now, what we need to do with AMP? That is called like glycic AMP. What a glycic AMP will do, particularly in bronchus, is it will relax the muscle. It will relax the muscle in lungs. So and then we have the like reason why we need to use that. The bronchodilators is the is the drug where we need to relax the muscle. So we at the end this thing converted and created a molecule called CAM which relax the airway. Okay. Mostly these drugs are used in inhalation or nebulization and orally. Orally, it is less preferred. We'll discuss about inhalation. 1 to 2 puffs. What is this inhalation? We use some people who is having an asthma have a familiar experience with this drug, right? Nebulization is a 2.1 mg in saline every 6 hours. Okay. And orally 2 to 4 mg 3 times daily. Now we need to know the route. Route will be inhalation preferred. Indications act bronchospasm. Bronchospasm means deconstructed muscle in bronchus due to serious COPD or asthma. Indication like acute, we already read that. Contraindications, cardiac, like if a patient having where we can't use. What are contraindications? Contraindications means the drug can't be used at that point or in that scenario. Here, the patient having hypertension or any cardiac related problems or hypothyroidism, hypersensitivity to the drug. If he's having any sensitivity to the drug or if he's having any problem with the heart or thyroidism, he can't be used. Drug interactions, risk of arrhythmia with theophylline or caffeine, pot- potentiated effect with other symptomatic effects with beta blockers. These are the drug interactions. Side effects, tremors, nervousness, palpitations, headaches, insomnia, adverse effects, tachycardia, arithmesis, hypocalcemia. These are the adverse effects and toxicity. Overdose may cause the same things, the same scenarios. Now we'll look after the nursing role. What a nurse should do while giving this drug. Assessment: monitor pulse, respiratory rate, O2 saturation before or after the therapy, before and giving and after the giving the drug. Administration: teach correct inhaler technique. Now let me ask you, how many techniques are there? How many inhaler techniques are there? Go look onto the internet or look your textbook and learn how many inhaler like techniques for inhaling. Safety: observe for tumors or palpitations. Education: we need to educate, avoid caffeine before and after taking this, and raise your mouth, open your mouth, breathe properly. These all the like we need to educate the patient. This is the nursing role for this type. Next type is anticholinergics. Anticholinergics composition: it is synthetic quaternary aluminum derivatives of atropine. This is the composition. And now we'll learn action of or mechanism of this drug. It blocks muscarinic, that is M3 receptors in bronchial smooth muscles. This is also a enzyme or a receptor. It is a receptor present in smooth muscles of bronchial, where in last type, what is the receptor we learn B2 receptor. Now it is M3 receptors which was present in smooth muscle, prevents acetylcholine mediated bronchoconstrictors. This specifically blocks acetylcholine mediated bronchoconstriction. This is the type which blocks these receptors. Okay, causes bronchodilation and reduce mucus secretion. It blocks the nerve that tells the airway to tighten. Okay, this is the concept. And dose, will know the dose. Inhalation 2 puffs. Nebulization 500 UC every 6 to 8 hours. Sorry, microgram every 6 to 8 hours. Indications: maintenance therapy in COPD used in beta 2 agnostics for acute asthma attacks. Contraindications: hypersensitivity to atropine or I- iprotropine, PM, glaucoma, any other risk related to that. Drug interaction potentiated with other anticholinergics, minimal synthetic systematic absorption. Side effects: dry mouth, throat irritation, cough, adverse effect, blurred vision, urinary retention, constipation. Toxicity is poor systematic absorption. It will be rare. Okay, nurse's role: assess the breathing before and after inhalation, instruct patient not to spray near eyes, encourage fluid to reduce mouth dryness, use bronchodilators before ipratropium if prescribed together. Okay, this is what you need to do. Last type is methylxanthides. We'll have example of theophylline. Okay, what's the composition? Purine derivative similar to caffeine. This is a purine derivative similar to caffeine. Action: what is the action of this drug? Inhibits phosphodiesterase PDE, which increases CAMP. We already know glycic AMP means glycic adenosine monophosphate, which is increased by PDE. After this, we know that when CAMP was released, it will automatically relax the smooth muscles. So this is the mechanism. Blocks adenosine receptors, prevents bronchoconstrictions. It will block the adenosine receptors and prevent a constriction of airway. Now we'll discuss about the dose. Oral sustained release tablet 200 to 400 mg twice a day. IV will be loading around 5 mg per kg or 20 minutes, then 0.5 mg per kg every hour. Route oral or IV. IV will be emergency. Okay. Indications: chronic asthma, COPD, toxicity, narrow therapeutic range, 10 to 20 milligrams per ml or 20 milligrams per ml. Toxicity may leads to nausea, arrhythmia, and convulsions. Nurse's role: monitor serum theophylline level regularly. Watch for early signs of toxicity. Avoid caffeine addictive stimulate effect. Educate patient to take drug at same time daily. Do not crush sustained release tablets. Okay. These are the nurse's rules you need to follow before giving this drug. So this is a quick summarized table. We have the drugs. We are discussing about bronchodilators. In that, it was classified into three types: beta 2 agnostics, anticholinergics, and methylxanthines. Okay. So next we'll discuss about decongestants. This will be our next class. For this class, we discussed about uh, bronchodilators. That's enough. I hope this class was interesting. I hope that you learned something. It is some quite a bit long. From tomorrow, we'll discuss very shortly and we'll complete each this chapter by tomorrow. Thank you so much for joining in the class. Thank you. Bye.